let's begin. First, we have Andy Tovar, who will be going over one of our DHCS social media platforms and share how this can be a useful tool to help you and Medi-Cal members stay informed and up to date. After Andy's presentation, we have Maria Romero Mora, who will go over the Medi-Cal Member Advisory Committee. We will then move on to our two main presentations for today regarding what has been shared with Medi-Cal members recently. So we have Andrei Bodrov, who will go over asset limit reinstatement, followed by Va Tyndall, who will go over the adult expansion freeze, and lastly, Basant Khalil, who will go over upcoming changes to the Medi-Cal Rx Pharmacy Benefit. We will then pause at the very end and take any questions before continuing with our live poll and ending our webinar. Andy, please introduce yourself before you begin.
Hi, I'm Andy. I'm the social media manager here at DHCS, and I just wanted to go over some of the content that you can find on our social media channels. So I will be sharing my screen. Okay, so we have started rolling out some communications on our social media Medi-Cal platforms. Just if you all don't know, our Medi-Cal channels, we are the social media platforms we are on for Medi-Cal are Instagram, Facebook, Twitter, Blue Sky, and Threads. So you can find us on any of those platforms, and our username is Medi-Cal DHCS. So the first thing I wanted to highlight is that we started rolling out communications for the asset limits. And so this is a carousel post that members can kind of swipe through to get a little bit more information on, what is an asset, who does this apply to, and kind of what the change is. So keep a lookout on all of our platforms. We're going to be rolling out more content and videos explaining Medi-Cal changes that are coming up. So I highly recommend you all following us. And then also, if you know any Medi-Cal members, to have them follow us as well. The second thing I wanted to highlight is our YouTube channel. We do have a YouTube playlist for Smile California. And this kind of goes through all sorts of just videos about Smile California, oral health, and also you'll notice that some of the videos are in Spanish as well. So just wanted to highlight this resource. I'll drop this link in the chat so you all can have it handy. And that's all I wanted to share today. So thank you.
For sharing such valuable tools for our coverage ambassadors. We will now pass it over to Maria Romero Mora, who will go over the Medi-Cal Member Advisory Committee. Maria, please introduce yourself before you begin.
Good afternoon. I think I'm sharing my screen. Morning, actually. It's good to be here. Thank you so much for the time, Isabel. I wanted to take an opportunity to share with you, maybe some of you may know this already, but we have a DHCS Medi-Cal Member Advisory Committee. This is where Medi-Cal members from the community come and provide their lived experience in their own words to the directorate, to DHCS, about their Medi-Cal experience, whether that is through the application process, the navigation of benefits, actual benefits, and so on. So we want to just extend the invitation to all of you to send us applicants, send us individuals that can share their experience. Two of the main requirement is that they have to be Medi-Cal members. They have to be Medi-Cal members, caregivers of Medi-Cal members that are current, that know how Medi-Cal is working today. We have a lot of stories from prior to the ACA, the Affordable Care Act, or even prior to the pandemic. We want to make sure that we're hearing experiences that are current to our community and sort of what is happening today on about Medi-Cal. So sharing my screen, just to give you a reference, I'll be dropping the website link on the chat. But from here, the applicant can go and submit their MMAC application. We accept applications year round. There's no timeline or things like that. If anything, it's just the fact that We need individuals that represent our Medi-Cal community from across the state. We have a lot of applicants and individuals from Southern California. We need a lot of people. We need more applicants from Central Coast, Bay Area, rural areas of Northern California, just to give you an idea in terms of who we are looking for. You can see the selection process will support applicants in the application process if necessary, and will provide the application in various languages. We have 1918 Medi-Cal Treasure languages, and we're making sure that everybody who wants to be part of it can have the opportunity. So without further ado, oh, and one last thing before I forget, there's an FAQ that if you want to, get more information, please look that out. But I'll drop the information in the chat. Reach out to us if you have any questions. And thank you, Isabel, for the opportunity to share this.
Thank you, Maria, for speaking to our coverage ambassadors about the MMAC. We will now move on to our presentations for today. We have Andrei Bodrov and Va Tyndall from DHCS presenting on asset limit reinstatement and the adult expansion freeze. Andrei and Va, please introduce yourselves before you begin each of your presentations.
Hello, everyone. Thank you for having us here today. My name is Andrei Bodrov, and I will be discussing the asset limit reinstatement before handing it off to my colleague Va. And
we will pull up the presentation just a moment.
Thank you so much.
There we go.
Okay, thank you so much. So as it was mentioned, starting January 1st of 2026, certain Medi-Cal members and applicants will have to report information regarding their assets, property, and they will have to pass under a certain asset limit, which we refer to as an asset test or an asset check. The groups that are impacted are individuals who are aged, individuals whose eligibility is determined based on disability or long-term care status, blindness, and then certain families will be impacted as well. Generally, most families do fall under the Magi Medi-Cal programs, which utilize our federal tax rules, but if individuals are over those income limits, then they may be impacted by this reinstatement of asset limits. Historically, in the state of California, we did have asset limits that matched the SSI program, which was $2,000 and $3,000 a month. In July of 2022, we did increase those asset limits to $130,000 and for one individual and $65,000 for each additional household member, up to household sizes of 10, where the increase would where it would no longer increase. In January of 2024, we removed asset limits in their entirety for these Medi-Cal programs, and we are now returning to those July 1st of 2022 asset limits. Next slide, please. As visible on this slide, we do have the asset limits. So for one individual, we do have the 130,000, additional 65,000 for each additional household member, up to a cap of 10 household members. Each additional member would not increase the asset limit for the household. So these are those phase one or increased asset limits, not the traditional asset limits that certain individuals would be familiar with, the 2,000 and 3,000. These are the increased limits that we did change in recent years. Next slide, please. Now, assets can either be real property or personal property. On this slide, we have a few of the most familiar types of assets that individuals will need to report. The particular assets do need to be reported, although not every single asset type or property type will be included in the calculation for eligibility. And the eligibility workers will make that determination for our community members, for our applicants and Medi-Cal members. They will need to report all of their assets, and then the counties will determine what is and what is not counted towards the eligibility. Next slide, please. For after January 1st of 2026, the asset limits will impact our Medi-Cal individuals differently depending on whether they are new applicants after that date or if they're existing Medi-Cal members. For our new applicants, the asset test will apply at their intake if they apply after January 1st of 2026. That means that these individuals will need to report their property information as part of their application process and will need to be under the asset limit in order to qualify for Medi-Cal under the impacted programs. If individuals are over the asset limit, they will have the ability to spend down their assets in order to qualify. Next slide, please. For our existing Medi-Cal members, these individuals will need to report their asset information and provide verification if necessary at their annual redetermination due in 2026. So for these individuals, it will be a phased approach when it comes to the impact for these individuals. They will have to report that information at their renewal while they renew their case. Similarly to our applicants, these individuals will be offered the ability to reduce their assets if the eligibility workers do find that their total countable assets are over the limits. And examples of spend downs are making payments on auto loans or debts, paying educational expenses, making repairs to a home, and prepaying rent or mortgage in advance in order to bring those countable assets within the threshold. So DHCS has collaborated with stakeholders and developed informational material so that we can definitely share the upcoming changes with those impacted individuals. For our applicants, we do have flyers that were developed so that they are present in the lobbies and can be informed when they are coming to apply for changes. And similar to our website, for individuals who are already on Medi-Cal, existing members, and who will have an impact at their annual renewal, we did develop our general informing notice and frequently asked questions going over some of the items that they will need to know and providing some examples of property that they will need to report. And this outreach material was shared with all individuals currently enrolled in Medi-Cal programs that will be impacted by the reinstatement of asset limits. We did complete our correspondences and sent out to approximately 2.5 million individuals that will be impacted by these changes. And if our coverage ambassadors would like to see some of our materials, it is available on our website under our Medi-Cal eligibility division informational letters, number 2523. And a lot of the information is summarized in our help center if you go through our the Medi-Cal website as well. And now I'll go ahead and turn it over to my colleague Va Tyndall to go over the adult expansion freeze.
Thank you, Andre. Good morning, everyone, and thank you for having me here. My name is Va Tyndall. I am a health program specialist with DHCS, and I will be presenting you the adult expansion population. So California expanded full scope Medi-Cal for all eligible applicants and members, regardless of their immigration status, in a phased approach beginning in May of 2016. The first phase for whom full scope Medi-Cal was expanded regardless of their immigration status was the young child expansion, children under 19, in May of 2016. The next phase was a young adult expansion for adults 19 to 25 years of age in January of 2020. Next, we have our older adult expansion for adults 50 years of age and older, which occurred in May of 2022. And finally, the age 26 to 49 adult expansion in January of 2024. Now, effective January 1st of 2026, individuals 19 and older who are newly applying on or after January 1st of 2026 who do not have an immigration status, have an unverified immigration status, or have certain non-immigrant visas, and who are not pregnant will be eligible for only restricted scope Medi-Cal. Restricted scope Medi-Cal covers emergency and pregnancy-related services such as prenatal care, labor, delivery, and postpartum, and long-term care services. Today, the adult expansion population receives full scope Medi-Cal coverage. It includes members from a variety of Medi-Cal coverage groups and programs such as adults 19 to 64, individuals with disabilities, and individuals receiving treatment for breast cancer or cervical cancer, among others. Members can move between the different Medi-Cal programs and maintain full scope coverage. Individuals 19 and older newly applying on or after January 1st of 2026 and part of the adult expansion population will be eligible for restricted scope Medi-Cal if otherwise eligible. If they are able to furnish proof of U.S. citizenship or a qualifying immigration status, they will be enrolled in full scope Medi-Cal. Children under 19 years of age remain eligible for full scope Medi-Cal after January 1st, 2026, and will retain full scope coverage after they turn 19. Individuals eligible to the former foster youth program remain eligible for full scope Medi-Cal up to their 26th birthday and will retain full scope coverage after they turn 26. Members of the adult expansion population who report a pregnancy and meet all other eligibility criteria will receive full scope Medi-Cal, which includes dental services, for the duration of the pregnancy and their 365-day postpartum period. The individual newly, I'm seeing some about the slides not moving. We are still on this slide. I apologize. There's just a lot of information, so bear with me. The members who attest to an immigration status on their application, I apologize, I was on the pregnancy one. So members of the adult expansion population who report a pregnancy and meet all other eligibility criteria will receive full scope Medi-Cal, which includes dental for the duration of the pregnancy and their 365 postpartum period. If the individual newly applied on or after January 1st of 2026, the postpartum period has ended, they will be eligible for restricted scope Medi-Cal. Individuals newly applying on or after January 1st, 2026, who are 19 and older and have certain unsatisfactory immigration statuses will be eligible for restricted scope Medi-Cal. Members who attest to an immigration status on their application who need to verify their status if the county eligibility worker is unable to electronically verify the immigration status, applicants will have 90 days to provide proof. This is referred to as the reasonable opportunity period, or ROP. Members who fail to provide their verification at the end of the ROP will transition to restricted scope Medi-Cal. If they are able to furnish proof after the ROP, they may be re-enrolled in full scope Medi-Cal from their date of application. Members who apply on or after January 1st, 2026 and have prior full scope eligibility within the last 3 months of their new application may re-enroll in full scope Medi-Cal if they are otherwise eligible under the grace period rules. Otherwise, they will be eligible for restricted scope. Individuals newly applying and eligible for restricted scope Medi-Cal and who are pregnant or in their postpartum period will be eligible for full scope Medi-Cal, which includes dental, again, just for the duration of the pregnancy and the 365 postpartum period. Following that postpartum period, they will be eligible for restricted scope benefits. Thank you all for bearing with me. Next slide, please. The adult expansion population granted full scope Medi-Cal regardless of their immigration status prior to January 1st, 2026. Those members will retain full scope coverage for as long as they remain eligible for Medi-Cal. To keep full scope Medi-Cal, Medi-Cal members must complete a renewal every year and continue to meet the Medi-Cal eligibility rules. If members lose their Medi-Cal coverage, they will have a 3-month grace period to fix the reason for the discontinuance. If they are eligible within the 3 months, they will be re-enrolled in full scope Medi-Cal. Next slide, please. The adult expansion population eligible for full scope coverage will continue receiving services uninterrupted. If they lose coverage for any reason, they will have a 3-month grace period, which is displayed here on this slide. So the grace period is different from the 90-day cure period. Members who are discontinued for the reason of failure to complete or provide information will be eligible for the 90-day cure period. If they're able to provide the requested information by the 90th day, eligibility for Medi-Cal may be granted back to the date of discontinuance without the need for a new application. The grace period is limited to the adult expansion population eligible for full scope Medi-Cal. If members are discontinued from Medi-Cal for any reason, they will have the 3-month grace period to re-enroll in full scope Medi-Cal. If that 3-month period has been exceeded and the member reapplies, they will be eligible only for restricted scope Medi-Cal. If the adult expansion member is eligible for the 90-day cure, it will run parallel with the grace period. The notice of action will provide the last date in which the member will need to comply for both the 90-day cure and the grace period to re-enroll in full scope benefits. If the discontinuance reason is not related to failure to provide, say they are over income threshold of 138% of the federal poverty level, the grace period will run independently. In this situation, the member will need to reapply by the end of the 3rd month and will be re-enrolled in full scope Medi-Cal if they are otherwise eligible, even if there is a break in aid. In this example, the member is discontinued, their last date of eligibility being April 1st, 2026. So we have the 1st month, April 2026, 2nd month of May, and then 3rd month of June. So they will have until June 30th to re-enroll in full scope Medi-Cal. Next slide, please. All right. DHCS developed and is currently mailing out outreach materials, which includes the general informing notice and frequently asked questions to members impacted by the adult expansion freeze. The outreach materials include details of the expansion freeze effective January 1st, 2026, and dental services will no longer be covered for the adult expansion population eligible for full scope Medi-Cal effective July 1st, 2026. The notice also provides a number of contacts if the member would like to reach out for more information. The mailing of these materials began November 7th and will complete on November 26th, reaching approximately 1.5 million members. Next slide, please. DHCS has also developed and presented training materials for both the asset limit reinstatement as well as the adult expansion freeze. Asset limit reinstatement was covered in 2 sessions in October, so on October 14th and October 28th. The adult expansion freeze was covered in 1 session on November 4th. On December 9th of 2025, CalSAWS, our system partner, will provide a system demonstration to the counties for both asset limits and the expansion freeze. Next slide, please. All right, you are all very vital in assisting DHCS with our communities. DHCS relies on our internal and external partners to assist with communicating these changes with the community. DHCS provides a new policy and guidance while trying to eliminate barriers to care for Californians. Our ambassadors help share the information directly with the public, whether that be in a clinic setting or maybe in an outreach event. DHCS relies on the community to share their experiences, questions, and concerns to help us find ways to improve their experience and not causing more barriers. So DHCS ambassadors and our community work together seamlessly. When one moves, the other moves. We are asking you to help us spread this information to all our members. We want everyone as well informed as possible so they can take the necessary actions to keep their coverage. Next page, please. All right, here's a couple resources here. So for more information on the adult expansion freeze, we have the All County Welfare Directors Letter, ACWDL 2513, and also Medi-Cal Eligibility Division Informational Letter, the MEDL 2522. And then we also, for the asset limit reinstatement, we have ACWDL 2514 and MEDL 2523. And those are all published on our website for you to review at your leisure. Next slide, please. And finally, if there are any questions after today, please feel free to reach out to us via email. For questions related to the adult expansion freeze, please email immigrationpolicy@dhcs.ca.gov. And for asset limit reinstatement, please send questions to assetlimitchanges@dhcs.ca.gov. Thank you all for your time this morning.
Thank you, Andre and Val, for your presentations. We will now move on to our final presentation for today. We have Basant Khalil from DHCS, who will be presenting on upcoming changes to the Medi-Cal Rx Pharmacy Benefit. Basant, please introduce yourself before you begin. And just a quick note for the Spanish translator to please pace yourself a little bit so she can get through and translate properly in Spanish.
Good morning, everybody, and thank you so much for inviting me to speak today about the state budget policy updates that will be effective January 1st, 2026. I'm Basant Khalil. I'm a pharmacist that works at the Pharmacy Benefits Division at DHCS. At the beginning of this month, Medi-Cal Rx began sharing information with the public about changes that are coming in January. Today, we'd like to summarize for you what's changing relative to the pharmacy benefits under Medi-Cal Rx. And DHCS will continue to share updates and more information as we get closer to the new year. So today we're going to talk about 4 changes that are part of the enacted state budget for the fiscal year 2025 to 2026. I'll explain those changes, who they affect, and what will be different next year. Most of these changes will affect all Medi-Cal members, no matter their eligibility, their age, or if they're enrolled in a special program like CCS or GHPP. If and where this is not the case, or there are exceptions, I will be sure to point that out. These changes are going to include coverage for over-the-counter COVID-19 antigen tests, exclusion of the GLP-1 medications used for weight loss, changes to continuing care for select products, and changes to over-the-counter product coverage for select medication. We also want to share some information about the letters that have been mailed to our Medi-Cal members this month so that you are aware of the communications that have gone out. And finally, we'll show you some resources that can be of assistance to learn more about these changes. Next slide, please. DHCS is charged with being a responsible and effective fiscal steward when it comes to all Medi-Cal covered benefits, and pharmacy benefits are no exception. This means that the department must consider how much things cost and how they're being covered. In recent years, the department has seen large increases in pharmacy costs. These budget changes will help reduce costs and focus on making sure Medi-Cal Rx works well and helps members get the care that they need on time. The changes we're discussing today are only those that will start January 1st of 2026. Any other changes that are happening as part of the budget that are happening at a later time will not be discussed today. Next slide, please. So we'll start with coverage for over-the-counter COVID-19 antigen tests that are available in retail pharmacy. And retail pharmacy settings, these are things like CVS or Walgreens and the like. Beginning January 1st of 2026, Medi-Cal members of all ages will need prior approval, also known as a prior authorization or a PA, to get an OTC over-the-counter COVID-19 antigen test. Pharmacists can prescribe these tests, which are available at the pharmacy as a single or 2-test kit. They can be billed to Medi-Cal Rx with a prescription. And the approval will only be up to 4 tests every 30 days. In order to get a test paid for by Medi-Cal Rx, there needs to be a medical reason. A member can get these approved for an over-the-counter COVID-19 test if the member has COVID-19 symptoms that started in the last 7 days, if they were around someone with COVID-19 without symptoms, if they have pneumonia that was caused by COVID-19, and a doctor or provider had a one-on-one visit with them and said that the test is needed. There are other types of COVID-19 tests that are covered through a member's medical benefit, and members may talk to their doctors about which test is right for them. Next slide, please. Next, we're going to talk about the glucagon-like peptide, also known as GLP-1 drugs. These medications are used to help with weight loss and weight loss-related medical conditions. And beginning January 1st of 2026, Medi-Cal Rx will no longer cover GLP-1 medications if they are prescribed for weight loss and weight loss or obesity-related conditions. This applies to everyone, no matter their eligibility, age, or specialty program enrollment. If a member has type 2 diabetes or another medical condition that is not related to weight loss, they may still be able to get the medication, but only if the prescriber shows it medically needed and it gets approved. This can be done through a prior authorization process on a case-by-case basis. The prescription will need to include a diagnosis to explain why the medication is needed. Now, for members under the age of 21, GLP medication may be approved under the Federal Early and Periodic Screening, Diagnostic, and Treatment Program, also known as EPSDT, on a case-by-case basis with an approved PA. To help members understand this change, the department sent letters to all Medi-Cal members, which arrived in their mailboxes approximately November 1st. The letter explained the changes and the options that member has going forward, including talking with their provider about alternate medications or services that may help with weight loss and maintaining a healthy lifestyle. Next slide, please. Up next are the changes to continuing care for select products, which will be implemented again for all members, but will have limited member impact. This policy change is specific to 8 medications that either are no longer in the marketplace or have been removed from the contract drug list several years ago. The usage of these products is low, and these drugs will no longer be covered benefits and will require a prior authorization after January 1st of 2026. Members who have received one of these medications in the past 100 days have received a letter as of November 1st explaining this benefit change. Their provider may choose an alternate medication on the CDL or submit a prior authorization request for approval if the drug is still available. Next slide, please. The final change that we're going to discuss today concerns changes to over-the-counter product coverage for select medications. Now, this policy change is specific to members 21 years of age and older. An approved prior authorization will be required for certain over-the-counter products for members age 21 and older. Vitamin and antihistamine claims will be restricted to a 90 or 100-day supply per fill for all members 21 and up. For combination multivitamin products, these products will not be covered for Medi-Cal members 21 years of age and older after January 1st, even with a prior approved PA. Members will need to talk to their provider about a single source vitamin option to treat medical conditions. And members that are enrolled in the GHPP program may continue to receive these products with an approved prior authorization showing medical necessity. For single ingredient vitamins, those that are listed on the CDL will continue to remain a covered benefit for members of all ages. For members 21 years and older, if a single ingredient vitamin is not listed on the CDL, these vitamins will be covered only on a case-by-case basis with an approved prior authorization. And as a reminder, vitamins used as supplements are not a covered benefit. For dry eye products for members ages 21 and older, these products will only be available with an approved PA. First and second generation antihistamines for members 21 years of age and older, coverage of medication that help relieve allergy symptoms will be limited to certain drugs and will now require an approved prior authorization. Chewable tablets and liquid allergy relief medications are restricted to members under 12 years of age, and claims for these medications will be limited to a 90 or 100-day supply per fill. Lastly, for the over-the-counter prenatal vitamins, coverage will be limited to individuals of reproductive age who are pregnant or breastfeeding, and claims for these products will be restricted to a 90 or 100-day supply, with the exception of the first fill. This can be for a 30-day supply to ensure the member can take the vitamin and doesn't upset their system. Next slide, please. As I mentioned earlier, the department has mailed letters to members for 2 of the policy changes that resulted in removal of coverage. for the removal of the GLP-1 drugs for weight loss and weight loss or obesity-related conditions, all Medi-Cal members 21 years of age and older, or the parent or legal guardian of a member under the age of 21 have received a letter that was mailed into their mailbox by November 1st. This has given members enough time to speak with their provider about other types of care to manage their weight, and additional information for submitting a hearing request if they wish to appeal the decision. Because some members will join Medi-Cal after the letters have been sent, the department will be sending a second letter in late December to members who may not have received the first letter. For members who are directly impacted by the removal of the continuing care coverage for the 8 medications noted earlier, a letter has been mailed as of the end of October. And as previously mentioned, the number of members affected by this change is small. Next slide, please. So to talk a little bit about the prescriber and pharmacy provider readiness to support prescribers and pharmacy providers in preparation for these changes, the department has met with key stakeholder groups, including managed care plans in October, to present information about these policy changes that are effective January 1st of 2026. The department has published alerts beginning in August to identify key changes, and 30-day rolling notices will be published, including the day of implementation. The department has worked on training Medi-Cal Rx customer service representatives to address questions and provide support for our members and providers, and additional resources, including a frequently asked questions document, will be published in mid-November with updates in December. Prescriber and pharmacy provider webinars will be available in December to review upcoming changes and answer questions. Next slide, please. We know this is a lot of information, and we want to make sure that you're aware of available places to get additional information. In addition to what's listed here on the slide, we are working with Medi-Cal Rx to develop additional sets of material, including FAQ documents and presentations. And we encourage you to submit your questions to the PBD inbox at medical.pharmacybenefit@dhcs.ca.gov, and to please pay attention to the Medi-Cal Rx website where information is posted. If you've not yet subscribed to the Medi-Cal Rx website, we strongly encourage you to do so, as important news will be published directly to your email upon release. Next slide. Thank you. Again, we value and thank you for your time and your partnership. The provision of the pharmacy benefit and services to Medi-Cal members requires the commitment of an entire network of administrators, prescribers, pharmacies, advocates, ambassadors, and Medi-Cal Rx, and we appreciate the partnership.